Welcome to the St. Vincent's Melbourne ICU proning video to be followed in crises where caseload is high and staffing is low. A proning team is utilised consisting of a minimum of 4 staff members, one of whom should be trained with managing the airway and will assume team leader role to guide the turning process. This video assumes that patient selection has been discussed with the ICU consultant and prone positioning is considered appropriate escalation therapy for the patient. Hand hygiene and PPE donning has been conducted in accordance with your local unit policy. Prior to gathering the proning team, the bedside nurse will prepare the patient as follows. Pre-oxygenate with 100% oxygen for at least 5 minutes prior to the turn. Disconnect nasogastric feeds and aspirate the NG tube. Check ETT securement, making a note of the tube position. Suction the ETT and assure that inline suction and end tidal CO2 are connected. Secure ETT and circuit connection points with sleek to reduce risk of accidental circuit disconnection. Ensure patient is well sedated and paralysed. Prepare infusions to continue while the patient is prone. Rationalise other infusions and disconnect any infusions that are not crucial, example drug lines, in order to simplify the process of proning. Ensure that infusion pumps are well positioned to avoid the risk of accidental dislodgement during the turn. Lubricate patient eyes with Chlorsic or an alternative ointment. Place gauze over eyes and tape them shut with a tegaderm to reduce the risk of corneal abrasion. Ensure that all equipment necessary for the procedure is available before gathering the team. And remove all monitoring except end tidal CO2, pulse oximetry, and the arterial line. The proning procedure. The most experienced person in the team will hold the airway and lead the team in performing the prone. This could be the bedside nurse, a senior nurse on the unit, or an airway-trained medical staff member if available. Prepare the slide sheets by layering 2 slide sheets together and rolling them up together. The slide sheets should then be placed on the mattress beneath the bed sheet on which the patient is lying. One team member will hold the slide sheets in place at the head end of the bed, whilst the other 2 members work simultaneously to spread the slide sheets under the patient from head to toe. A cautious amount of energy is often required. Now ensure patient's arms are tucked beside the body neatly. Place 2 pillows over the patient, one over the chest and shoulders, and one over the pelvis. Now place a bed sheet over the patient and align this with the bottom sheet on which the patient is lying. Roll the long sides of the top and bottom sheets together, wrapping the patient up into a firm cocoon. Two team members will stand on the side of the patient furthest from the ventilator, and 1 team member will stand on the side of the ventilator. The team leader will be at the head of the patient, holding the ETT securely in place. At the call of the team leader, slide the patient across to the side of the bed furthest from the ventilator. Then, turn the patient on their side, facing the ventilator. At this point, the team members furthest from the ventilator will have their arms supporting the upper side of the patient, whilst the team member on the ventilator side will have their arm supporting the bottom of the patient. One member from the further side will now join the ventilator side. The team members on the opposite sides will now swap their hand positions so that the 2 members of the ventilator side of the patient will support the upper side of the patient. The single team member furthest from the ventilator will then hold onto the topmost slide sheet and pull that through so the patient is turned over, coming to rest in the prone position. Unwrap the bed sheets and check that the pillows are well positioned to cushion the pressure areas. An additional pillow or cushion may be placed under the legs. Now, confirm that the patient is ventilating well and that the ETT position is unchanged. At this point, we would reattach monitoring. ECG jots will be placed on the patient's back. We'll check that the eyes, forehead and chin are free from pressure areas and use a face cushion or gel pad if available. The arms will be positioned into the swimmer's position. The head position should be turned every 2 to 4 hours and the arm position changed accordingly. Remove the slide sheets from under the patient and tilt the head of the bed up to 30 degrees if safe to do so. The bedside nurse will be left to continue with the usual checks to ensure that lines are not kinked and to restart the usual infusions and feeds.
Deproning. Before gathering the team to deprone the patient, the bedside nurse will undertake patient preparations as for the proning procedure. The only exception in this case will be eye lubrication. The team will once again comprise of 4 people, with the senior-most team member assuming the role of airway support and team leader. Once the bed is flattened, the team members will prepare the overlaid slide sheets in a manner similar to that for the proning procedure. The slide sheets will be spread underneath the patient between the bed sheet and the mattress. Once the slide sheets are in place, you may remove the pillow underneath the patient's legs and ensure that the patient's arms are tucked safely beside their body. The team will now wrap the patient into a cocoon using the top and bottom sheets and following the same procedure as for the proning video. Once the patient is firmly tucked into the cocoon, 2 team members will stand on the patient's side closest to the ventilator and 1 team member on the opposite side. At the instruction of the team leader, slide the patient horizontally towards the side of the ventilator. Then turn the patient onto their side, facing the ventilator. Support the patient briefly in this position while 1 team member moves over to the side furthest from the ventilator. The team members away from the ventilator will then gently support the patient back into the supine position, and the single member on the ventilator side will gently pull the top slide sheet. Once the patient is supine, check that they're ventilating adequately and that the ETT position is unchanged. At this point, usual monitoring will now be reattached and the tape around the eyes can be removed. It is important to check all pressure areas and document any injuries that might have occurred. All pertinent infusions may now be restarted. Sedation and paralysis break may be considered in discussion with the medical staff.